Welcome, everyone, to the Health IT Nexus podcast. Health IT Nexus, where healthcare, information technology, and business converge. I'm your host, Charlie Malio, and today I'm pleased to have as my guest Jeremy Marut. Jeremy is the founder and CEO of Sublimation Health. Sublimation Health helps healthcare organizations migrate and manage critical applications in the cloud. They offer a comprehensive set of services from planning and migration to fully managed hosting of your EHR and application portfolio ecosystem with a proven, secure, and agnostic cloud-first framework. Jeremy, thanks for being on the show today.
Well, thanks for having me, Charlie. That was very professional. I love that. I'm going to have to take a snippet of that to put on the website.
Hey, I appreciate that. So for those who are new to the show, before we get down to business, we like our audience to get to know our guests a little better on a personal level. And we do that by asking them to share a fun fact about themselves, which we'll touch on now, and then we'll return to a little later in the show. So Jeremy, with that in mind, what can you tell our audience about Jeremy Marut that they might not know?
Oh, my goodness. So many things. I'm just a weirdo. Big Jersey guy. So everything from being a big Housewives of New Jersey fan to, I just had to lower my Christmas music outside. I'm one of those guys that the Christmas, soon as Thanksgiving turkey's done, I'm into Christmas and the Christmas music is on. But I'm also a real Jersey guy, so my kids get a kick out of if you're driving with me. I get a little bit of road rage or a little, perturbed. You got 1 minute of me screaming red faced at the guy or gal in front of me driving, and then I go right back to whistling chestnuts roasting on open fire.
That's true Jersey. Well, hey, that's, it's good. We'll talk a little bit more at the end about New Jersey, but and I'm looking forward to hearing about it. But right now it's time to talk about healthcare IT. So, Jeremy, I know you spent many years working in healthcare provider organizations, leading enterprise infrastructure teams. Can you tell us a little bit more about your background and what led you to starting your own company?
Absolutely. Maybe you'll be my psychiatrist and straighten me out here. 25 years I was on the health system side. Worked my way up from graduated as a developer. Nobody would hire me, so I worked for a year for free at a Hackensack Medical Center here in Jersey. And then got the opportunity at the end of that year, really kicking butt to get a full-time job. Thought I was absolutely completely rich when they wrote the number on the piece of paper, but that's how naive I was. I just worked my butt off from that day forward, helping at Hackensack University Medical Center. Then around 2012, my life got switched upside down when Dr. Shafiq Rob joined us as the CIO. And he asked me, he met one-on-one with every single employee in IT. And he asked, what do you want to do with your life? And I told him I want to be in his chair one day. And he never let me forget that from that day forward. And really gave me the opportunity to expand out of being just a developer and an architect and an application person to really get into the business of healthcare. And if you can name a role in healthcare IT, I probably had it or was a temporary in that role for some time as I was, learning all these things, everything from revenue cycle to lab systems to radiology, patient transport. In the mix of it, working for Dr. Shafiq Rob, you're always on the bleeding edge, not even the cutting edge. I mean, he'd get an idea sparked in his head and, he always said your brain would be downloaded to a USB in 7 years. And, the day he would say that in 2013, he expected that was done tomorrow. So a lot of what we did was using what we had, not going out and buying another piece of software and another vendor partner and another, innovation by somebody else. It was, what do we have in this place and what is our goal in our job, right? And it's saving lives. Like every single one of us, he transformed that department to we believed we were saving lives. When they would ask you the annual, what do you do at this place to support our mission? People would be like, previously we put computers out. The answers overwhelmingly moving forward were, we helped reduce length of stay by a day. We saved these many lives with what we did. So he really instilled that, for the patient, for the caregiver, for the provider, experience was top of mind always. And hey, how can we change what everybody's doing, what the status quo is, and actually finish it, not have these pet projects? So, talk about having every job. I really wrapped up at Hackensack when they helped get the merger done. Now they're the largest health system in New Jersey, Hackensack Meridian. So I'm pretty proud of that. I wore a hard hat for many months when we built the first private medical school in New Jersey in like 60 or 80 years or something crazy. So really got to experience all the way down to construction. But once that merger went through, the writing was on the wall that they weren't really into, advancing innovation anymore, crazy technology as the driver for marketing. They really had to shift focus to combining two massive cultures that are different, and creating this health system across the state. So Dr. Rob left around 2017, and about 3 months later, I was just miserable doing the grunt work of merging massive healthcare institutions. He went off to Rush in Chicago, and I followed him shortly after. At Rush, I was supposed to go start the Center of Innovation. And while we were there, about a year into while we were there, had the second major outage of my lifetime. We're talking over 18-hour outages of everything, not just Epic. This actually happened at Hackensack a year and a half before that, and the same exact 1 in a million problem. Storage array controller went out in our storage environment. We had multiple data centers, redundant everything. When the failover happened, nothing worked for hours upon hours upon hours, because this is healthcare and our technical debt and the way that we've traditionally gone through, again, 25 years of this stuff. Everything's hard-coded IP in this situation.
Right.
The important stuff. So I learn off of really bad environments and scenarios. In fact, when I do my interviews now, I'm down to really one question. Tell me your worst disaster and how you helped get out of it, because it answers so many questions. It answers your experience. It answers how you interact with other people outside of your department in operations, the patients, right? And how you brought it all together and how you got out of that. So this is the second time we've been in a major one. Once you're in this leadership role, right, you're in those war rooms in the health systems where all the VPs, EVPs, president, CEO is in there trying to figure out how to get back up. And when you're working with operations, you've got pharmacy says we got to be up before patient transport. Patient transport wants to be up before radiology so that they get the people down to radiology, right? And everybody's got their mojo and their flow going. Then they turned around to IT and they're like, okay, guys, that's the order. We need stuff coming up. And then we look at each other and say, okay, we know server 65G93.7 is ready to go, but what comprises pharmacy? What does it mean that pharmacy's up, right?
I think, that, Jeremy, highlights the importance, right, of when you have to have a disaster recovery plan, and that plan can't just involve IT. That really has to involve every critical department in the organization, so that if and when an event like this occurs, everybody has the expectation of what's going to happen and when, what's going to come up, and how we're going to handle it, right?
You hit it on the head. But it is also sad to see places that have those plans, yet when you dust them off, everybody looks at each other, they don't know what they're doing.
Right.
And from the technology side, the part that our house isn't in order. We don't know what does the package look like. That's pharmacy. What's the package look like? That's radiology. Other than that, I have a whole bunch of servers running a whole bunch of apps, and I got to get, on average, 4 different types of people to come together to really figure out in an emergency what the heck is going on, from the application SME, the application installer, the server installer, networking, and what have you. So long story short, not short, Dr. Rob turned to me and he's like, listen, I really need help. I need somebody trusted to take over as CTO to really sort this out. We've been through 2 massive outages like this, and all around the country, the globe, these things are happening. We got to figure out how to be always on. Forget about this recovery, this disaster stuff. Let's figure out how this thing is stretched across as a fabric. And by the way, cloud has been around for 20 years. Let me figure out, me being Dr. Rob, figure out how to convince the board not to fire me. But we've got to figure out how to get out into the public cloud. And that was about 2017. That's what really kicked off our really deep exploration into what's happening in cloud itself. What is cloud doing with healthcare or for healthcare? And we always believe go straight to the top. So fly out and see Satya, fly out and spend many, many weekends with TK for Google. But AWS was the big, remind me of Epic of old, where you don't go to Epic. They tell you who they're going to do business with, really. But we finally got out there. It wasn't Andy Jassy. That was a couple weeks later, but we got there to Seattle, sat down. And when we sat down, again, granted, this is 2018 time frame, 17, 18, they gave us the half-hour speech that we came in giving everybody. That this isn't about servers. It's not about moving OS and portability and stuff like that. It's really, they were looking to get into healthcare to change it. Everybody talking about transformation, but the power of Amazon and Pan Amazon and using all of their services together, that's really where they were headed. And first and foremost, any partner hyperscaler you go, it's got to be able to run your environment. And back in 2018, especially with Epic, nobody could, not even AWS, but they had that vision, and it was a mindset. We're always about mindset. I love Hackensack's old marketing department. Even today, they're great, but impossible is just an opinion. That has stuck with me since 2013, 2014 campaign, that we know change can come. We know that these are possible. The only impossible pieces are forces that we can change, like our vendors' opinions, people's concern about security and stuff like that. So we signed with them. I'm going to fast forward really quick because we're using a quarter of this thing on my backstory. But we started the project there. COVID hit. Everybody got let go if you're a contractor, and I'll always live in New Jersey according to my wife and family. So I was a commuter to Chicago. I was one of the first people gone. Luckily, blessings abound. The president at Rush took the CEO job at what was Wellforce and is now Tufts Medicine, which was a burgeoning health system. 3 independent hospitals, about 5 years they've been together, but completely still trying to figure it out. 6 EHRs, EMRs, 90 something, I'm not exaggerating, patient portals. So Mr. Dandorf took the job, turned to Dr. Rob and said, hey, please follow me here. I think this is a great place for you. We're just starting to bring this together. I want digital transformation to be our unifying North Star for the entire organization. And by the way, Epic's going to be at the core of that. And Dr. Rob and I have done Epic many, many times. So Dr. Rob headed up there. Of course, reached out to bring me in because we knew there what we were going to do. This was 2020, July, August of 2020. At that time, there was still nobody fully out in the cloud. There was little DR, little non-prod, dipping the toe. But again, remember, for 3 years already. We've been going around the globe, Singapore, London, checking out all these labs. Like, we knew very well what we were going to do. We also knew that we weren't going to use a partner. Because of the exceptional amount of experience that we had, we believed that we knew how to get these applications moved to the cloud better than these third parties that were out there at the time. Again, now we're 4 years ago, right? I think the biggest thing anybody had ever did a mass migration of was like GMC or something like that, websites. So we gathered the entire organization. Again, a lot of our methodology is built on Epic methodology because it's very well proven. And the first thing is, it's never, just like you alluded to earlier, this is not an IT project. First and foremost, it will fall flat on its face, fail, and will be another HIMSS where cloud wasn't ready for us.
Right.
But we had, right from the CEO, we walked into the boardroom, and it happened to be that cybersecurity insurance was out of control at that time, and we were about to vote on not having it. Mm-hmm. And when the adjusters found that we were going with an AWS all-in strategy, we got a lot of credit. And that was our in with the board. Like, oh, this might be a good idea. Okay, Shafiq, go with it. So I'm very proud of what we did. Dr. Rob turned to me in Thanksgiving of 2020 and said, all right, now you got to go and do it. We got everything signed, ready to go. And that's when I've built many teams over the years. It's one of my passions. I love it. I like getting people together. I like picking the right people. I love the chemistry aspect of it. And piece by piece, brick by brick, we built it out. One of the big things a lot of people don't realize is that of the 18 people we assembled by the time we went live, 0 cloud certified people, double 0. Not a single person had a certification in cloud. Our core philosophy, and to this day of Sublimation Health's difference, is we are all healthcare people first. We're healthcare application people. We're jacks of all trades also. None of this specialization and I just give an IP address to the server. All right, we got real techie, motivated, lifelong healthcare people who all of a sudden were liberated by like modern technology and like, wow, look at what we could do. So this group of non-cloud certified Epic and healthcare experts in 14 months did the entire first full, nothing on premises Epic. You will not find a single thing on premises for Epic other than some of the BCA PCs, as well as what we called lovingly the 40 Thieves, Alibaba and the 40 Thieves, 42 mission critical integrated apps, right? Because we went back to being in those war rooms when everything is down. And we learned from those multiple occasions, okay, these are the critical functions that run a health system. And if we have a cyber event or a network outage or whatever, these are the things that you need to have on to keep the business running. Never mind just taking care of patients, right? You could be up and have nurses take care of patients without electricity. But to actually function, collect your payments, send out to insurance companies, get your blood work done.
You got to pay the bills. You got to get the money in. You got to pay the staff, right? The docs, the nurses, everybody's got to get their paycheck. That's important. People, overlook that. You can't,
Right. So 40 of them. And we went live with 42 and again, just 14 months. So as you can imagine, I am so proud of that. Being the first time it's ever done, having to write the book, effing up many, 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 many times. Again, remember I said I learned my best when we F up.
That's how you learn, right? You learn from your mistakes.
Rebuilt and rebuilt and rebuilt. I love to use the surgeon methodology of the way surgeons are trained. See one, do one, teach one. Although now I just met a surgeon I just became friendly with who said, yeah, we killed a lot of people with that method, so maybe not so good. But it was phenomenal. And I actually started the little LLC when we started the project because in my head, Tufts was going to spin us off. We're going to be this fully operational company. Like, can you believe what the hell we did? And then, boom, the reality of recovering from COVID loans and everything, just like every hospital, they had their difficulties. But I got the blessing from Mr. Dandorf and Dr. Rob to go hang my shingle. I'm a glutton for punishment, I guess, because I really could have went and done this in any industry. Had a lot of offers from the big ISVs because they saw what was done and that this was an early and very big hype. But for some reason, I still felt that, like, I could do this, and even if I had to build it again from scratch, that I could get it done. And that we had that experience still, now that nobody had. Never mind, they didn't have it 4 years ago. Now we moved a couple years forward and we actually did it to build upon that experience. So I went out crazy, looking for investors. Everybody wanted my left kidney and my right lung, or, give me a paycheck and just take my company. I work for them. But I found Mr. Bob Bailey, who over the years did a lot of business with him. He's got an investment firm. He's the founder, and well, now he's not the CEO, but he's the board chair of Healthcare IT Leaders. Pretty big implementation firm, and he made a really nice investment. Gave a great commitment to cash flow positivity, and set me on my way to be an entrepreneur CEO.
And
All of
now
a
you
sudden.
guys are, helping other healthcare organizations make that migration to the cloud, which, I think they need a trusted partner. And your story is a great one because you lived it, right? You weren't a vendor coming in with all these ideas. You were in the trenches doing the job they're doing and had to figure out, without a lot of help, how to get this thing working in the public cloud. So I think, that's probably the value I would think that a CIO would see in partnering with you, is that you've walked in their shoes.
I'm there's so many cliches that come up with this business stuff, and I'll never be a business guy. It's so hard for me to tell somebody to pay me for something. Thank God I've surrounded myself with good people who handle that stuff. But that's what I pride myself on most. Like, I love going to a customer and doing a workshop or having a session. You cannot believe, time and again, oh my gosh, I thought I was coming here for another waste my whole day or 2 days. Like, we're getting people tell us that in 20 years they haven't been to a session that's been this informative because of the fact that I'm not selling. Somebody told me, hey dummy, it's because you're not selling that you're selling. To be able to go in, and there's some big companies that got real superstars that have been doing this for a long time, but when it comes from the actual CEO and the founders, have been doing it for a long time and are very knowledgeable in, put it this way, it's a lot easier for people to migrate an epilepsy monitoring solution if you know how epilepsy monitoring tech goes in and trims their videos or doesn't, how to migrate that over effectively and in an optimized fashion than somebody who moved a GMC dealership. Very different. And I pride ourselves on getting those kind of kudos. Having been in the seat, I think it really it hits differently with a lot of these CTOs and CIOs, to be able to speak on the level of the engineers too. That one's near and dear to my heart, to involve those men and women that are behind the keyboard that don't want to be pulled out to another freaking session and learn some new technology, or, oh, we're just going to do the same. For them to come and be like, dude, you did it. Like, I love that. That feels so good, and that's why we'll always build this company out that way, and it's our biggest strength, I think.
That's great. So what I'd like to do is ask you let's do a little rapid fire round where I'm going to ask you to help me bust some common myths about the public cloud and just give me a sentence or two about maybe debunking some of these things, okay, or not, right? So the first thing I hear a lot is about the public cloud is, hey, we're in healthcare and it's not secure.
Well, I mean, that's a big one where I gave the example earlier where, in fact, the security is what helped us convince the board to go with it. And this isn't because we said it was more secure or because the cloud vendor said it was more secure. This is third-party assessors and security insurance firms who came in and said, oh, the shared security model, Amazon and Microsoft have $3 trillion. If you took a smidgen percentage of that, it's still 20 times the security budget that any health system on the planet has.
Right.
So, right, putting it together. Now, I must tell you, I made the mistake too of thinking that cloud's going to solve everything, because it is a shared model. And you do need to have the security in the cloud planned out. The great part about it, when we talk to CISOs across the country, a lot of them are very relieved. Some are very worried, but a lot of them are relieved because this becomes a green field for them. And they say, if I could do it, if I could recreate this from the beginning, right? If I just had a blank empty data center or a brand new company, let's say, and I'm the CISO and I get to do this from scratch, that's where they see that opportunity. And the more and more natively available security products that are baked into the services, or you can buy from the marketplaces and lay them right on top of the services. It's just all integrated, all by code, and all callable directly. So yeah, you can make a really not secure cloud, but you know you have half the battle solved of the platform. The platforms are ultimately ultra secured. It's making sure that planning, and again, at some point we'll go into, I'm going to beat the hell out of the planning piece, because a lot of folks still to this day are just skipping over a whole chunk of the planning. You got a lot of planning to do, what I call your golden architecture. But with that planning, you can have a pristinely secure environment, not to mention all these applications out there, including the Epics of the world, coming up with these isolated recovery environments. The fact that these are code and you can make these bubbles of environments, you can have an environment completely detached from everything. Imagine old school air gapping, that's functioning, right, in its own like snow globe. And then when it's time to break the glass, that thing's available and untouched by anybody.
Yeah,
Um,
think those are all great points. So, how about this one? If I go to the public cloud, I'm going to lose control of my environment. Is there any truth in that?
Again, it depends on the situation you get into and how you go about it, right? So certainly, if you outsource the whole function, you lose plenty of control. If you want to keep it internally, the way that we approach most of our workshops, like when I start talking to anybody in leadership position about cloud, is I never say the word cloud. I take the whole word cloud out of the conversation. And all we're talking about here is a traditional co-location. It's another data center, right? You've got to get the connectivity to it. You've got to secure it. You fire up servers instead of in VMware. You're firing up native virtual machines in the platform that you're in. And you have the full control. You actually have more control because every part of everything in the infrastructure is exposed as code. So you have the ability to go way, way deep as you want to go into a rabbit hole of locking down, securing, or controlling any piece of your environment way beyond what is in a traditional physical data center.
All right, that's a great point. Finally, I hear this one a lot, and maybe I hear a little less than I used to. But if I move to the cloud, CIO might say, if I move to the cloud, I'm going to be out of a job. I don't know if I want to do that. Is there any is that something they need to worry about, or what happens to their IT department if they're moving all this stuff to the cloud?
You know, you got Sam Altman the other day saying not everybody's going to be happy. And you got to be truthful, right? Not everybody's going to be happy. But when we come in the door, right, for me, one of our mission, one of our vision and mission here at Sublimation Health is that we get you out of the data center business and we get you into developing solutions that is core to your business, which is healthcare and a health system, not running hospitals and clinics, right? So instead of spending every couple of years rejuvenating your old crap, trying to make sure you don't run out of stuff on your old crap, trying to make sure that you get enough new crap, so you don't run out of stuff in the next couple of years, and that it's all on. That is not part of the business of your hospital. And eventually, at some point, I mean, if you don't lose your job to cloud, someone's going to figure something out and say, hey, we have way too many people doing this job because it's just grown and grown and grown. That said, we're not looking to take anybody's job away. We're looking to modernize them and change their job and make it enjoyable and joyful again. right? Why does somebody want to come in and make sure you're not running out of space? Somebody does want to come in though and connect the families in the NICU with their families at home through digital rounding, right? That's not something the cloud can create. The cloud can't create a fire interface and write it, to connect these doctors' offices together. That's people, that's architects, that's developers, that will do that stuff. And that's where we're seeing and trying to help move people's skills from just keeping the lights on, this rote work, to actually creating solutions in an environment that you own and have unlimited services available to you to innovate with.
It definitely, I think, CIOs who have moved to the cloud realize that it gets the sort of the mundane nuts and bolts IT stuff off their desk and lets them focus on real innovation, right? So how do I leverage technology to bring innovative solutions to healthcare delivery? And I think that NICU example you gave is a great one. Um, so with the time remaining, what I'd like to ask you to do is, okay, I'm a CIO. I want to embark on this journey. I've done a lot of research. I'm saying, yeah, I think I want to go to the public cloud. It makes some sense, but what advice would you give them? Where do you start? I mean, how do you, if I'm already, say I'm running Epic today and I've got 100 applications that surround it and all this stuff. And how do I even begin the process of figuring out how I'm going to do this?
Uh, that's a good one, because it's a very simple answer is the first question that, the CIOs are super intelligent people. It's how they got into these jobs. Um, a lot of them have very big egos too, so they fancy themselves be able to go out and figure this stuff out. But the number one simple answer is you got to figure out why first and foremost. And again, not making it that it's the IT department's project, right? Being a CIO that has a seat at the table with the CEO, the CFO, the COO, you have to take this in as an actual strategic business project, right? And you're going to first need, you go with the impact advisors of the world when you're looking for Epic or an EMR. Just as with any major transformational foundational project for an organization, you're going to want somebody that's going to be able to help you figure out those whys out, right? Or be able to sell it from a business perspective, and not just skip all the stuff in between, right? The CFO needs to understand, okay, what it's going to cost day one, what it's going to cost on the third year, and then, how far out we're going to have this ROI go. The CEO needs to understand that we're making this thing so resilient that he never has to even think about, oh my gosh, are we going to have a problem from IT again, right? Or how could we use this to advance any of the hundreds of different campaigns that we have, to outreach into the community. So first and foremost, figure out why you want to do it. Are your data centers end of life? That's a reason why. Are you completely not secure? That's a reason why. Are you looking to? Are you an innovation CIO, and the health system is riding that wave of, okay, we're gonna go and do some impactful innovation and AI stuff because everybody's talking about AI. Okay, well, we need the for AI. No way we're going to be able to afford it in our basement or the couple garages that these data centers are in. So figuring out that why, and being that actual business leader to corral all the leaders towards that. This is what we're doing. This is our North Star. It's not about cloud. Cloud is the foundational component that's going to enable us to build these solutions, going to enable us to have unlimited capacity to flip on those AI models once they actually mean something, or for us to actually take part in them. So I think first and foremost is sitting down in a room or talking to yourself in a corner and saying, why the heck am I even doing this? And then taking it from there, finding the right partner. If you're, as I guess I'll say, I was arrogant too and believe nobody could help me. If that's the case, you're going to want to do what we did, though, and get on a plane and fly to the actual top of the heap, right? Because if you're going to do it by yourself with people, you don't have that experience, You're going to get a heck of a lot of different stories from a lot of different people in different levels of those organizations as well. So go out there, make those relationships with the leadership of the healthcare verticals in those organizations, but also get in the face and get your name known to the CEO. It's not impossible for us to go sit with Satya Nadella. I'm telling you. He was on the stage with Judy at Epic. You can go talk to the guy. You just got
Yeah,
to figure
no,
out how to get there.
that's for sure. Well, that's good advice. And I think when you talk about it, Simon Sinek had a very famous book about start with why, right? And I think that's great. It's great advice for a CIO to, if you're going to do this cloud journey, start with why, understand what you're doing. It's a strategic initiative for the whole organization. So Jeremy, before we conclude, I just want to circle back and revisit. You're a Jersey boy, so I got to ask, how many times have you seen Springsteen live?
None.
None as a Jersey boy. See,
I'm not a Springsteen guy.
really?
Yeah,
Wow.
so maybe the surprising stuff, like I'm not a Springsteen guy. I don't like the Beatles, has nothing to do with Jersey, but people are like, oh my God, like Beatles. I'm more of an AC/DC Metallica person, but also heavy into the rap side of things, but no Bruce.
Okay. Oh, that's fun. I've seen Bruce 2 dozen times, and if
Really?
you're if
I
you're a
work with
Bruce and
so
if
many
you're a real
people that
hardcore Bruce
love
fan,
him.
that's not a lot. That's
Oh, that's
actually
nothing.
that's
That's
nothing. I know
absolutely
people have seen
nothing.
him hundreds of times. So, well,
Hundreds.
Jeremy, I really want to thank you for taking the time out of your schedule to be on the show today. And I hope everybody found our conversation as enlightening as I did. I think we all learned that, public cloud presents both opportunities and some pitfalls. And it's really imperative, if you're going to do this, that you want to partner with the right organization if you want your cloud journey to be a success. So this has been the Health IT Nexus podcast with today's guest, CEO and founder of Sublimation Health, Jeremy Marut. Healthcare IT Nexus, where healthcare, information technology, and business converge. Whether you're a healthcare provider, healthcare information technology vendor, value-added reseller, or a private equity firm with a focus on the healthcare vertical market, learn more about what Health IT Nexus can do for you at www.healthitnexus.com. And we hope you'll join us next time here on the Health IT Nexus podcast, where we speak with a guest from the healthcare IT vendor community to discuss their company, their solutions, and how they're improving the delivery of healthcare through the use of technology.